Welcome to today's Ask Me Anything. This AMA is going to be a series featured on the YouTube channel, and I'm going to be soliciting these questions through my Instagram stories, Twitter, or right here on this channel with posts requesting additional topics and questions that we can cover. This AMA series is designed to be listened to almost like a podcast, so if you want to skip ahead to a particular topic, you'll find chapter selections in the video description, or we'll have timestamps in the podcast show notes. Although there are going to be some visual elements in the YouTube video, you'll be able to put this down and listen to it in the background if you desire. There's 3 topics that we're going to be covering today, and that's going to be microneedling, retinol, and sunscreen. Again, timestamps will be in the video description, so you can jump ahead if there's something that you want to know. This isn't intended to be a completely all-encompassing type of answer on these topics, but just the questions that came in we're going to cover today. So without further ado, let's jump into the first topic, which is microneedling. Just to get it out of the way, the first question that came in is, what is microneedling and what are its benefits? Microneedling has been around for quite a while, and it usually is a device. It looks like a pen or some type of machine with lots of little needles on the end. This is intended to be applied to the facial skin, either in a gliding motion or in a stamping motion, and these hundreds of little tiny needles poke into the skin at varying depths. And usually this is something that we can control, whether we want it to go in 0.1, 0.2 millimeters, half a millimeter, 1 full millimeter. Some devices, depending on their settings, may even go up to 2 or 3 millimeters in depth. Now, as these tiny little needles penetrate the skin, you may notice a little bit of pinpoint bleeding if they're going deep enough that they're getting to some of the blood vessels in the skin. The needles are so small, however, that you're not generating enough of an injury to cause true scarring, but it is enough of an injury to stimulate a cascade of healing response in the body that you generate new collagen, which is often going to be healthy, more youthful appearing collagen. So a series of microneedling treatments may help to improve the look of fine lines and wrinkles, and in some instances may help with some discoloration or pigmentation if you've been battling that, depending on the type of skincare products that you use in conjunction with your treatment. So in general, microneedling is a treatment that uses tiny little needles that are inserted all over the skin due to this little motor in the pen as you sweep it around the skin, usually because you have a gliding solution of some kind, and that little injury generates new collagen to improve the texture of the skin. Most microneedling treatments have very little downtime, which means the results are also going to be modest. So you shouldn't expect huge laser-style results from a device that is only giving you a day or 2 of downtime in most cases. The next question is, can I combine microneedling with subscision? Now, subscision is a treatment that we don't do quite as often, but for the right type of scar, subscision can be great. So when we have scars that are tethered down to the underlying structure, so we have like a scar tissue band that goes from the skin down to the fascia overlying the facial muscles, that little tether can really create quite a pockmark in the skin. And no matter how many times you microneedle over the top, you're not going to be releasing that band that is tethering the skin down to those deeper layers. You're always going to have that dimple. What we do with subscision is we usually will numb the area with a little bit of lidocaine just next to the area where that tethered band is present. Then we take a specialized type of needle called a no-core needle. And these look pretty gnarly. You wouldn't want to use these for an injection of any kind or starting an IV because they're almost like an 18-gauge needle with a small blade on the end. And we'll insert that under the skin, and then in a sweeping motion, we'll go ahead and slide underneath that tethered band of scar tissue and sweep and actually cut that tethered band so that the skin can release up off of that fascia and you no longer have that dimple in the skin. Subscision is something that should be done by a professional because it is using a bigger needle that is penetrating under the skin, so the risk of infection or bleeding does go up as compared to microneedling. But the question was, can you combine subscision with microneedling? And the answer is yes. So in the hands of a trained dermatologist, this is a procedure that could be done at the same time. You do just want to be careful that you're not increasing your risk of infection, so sterile procedures need to be followed, and you need to understand your aftercare. But if you're using microneedling as a way to help address acne scars or other types of scars, if you have the right type of scars, subscision could be a complementary treatment to that. How often should you do microneedling? This is a common question that I get in the clinic and online. And remember that when we're doing microneedling, we're actually waiting on the body to generate new collagen, and that process doesn't happen overnight. So even though you may have gone through a microneedling treatment and the skin has completely healed over, it's not sensitive anymore after 5 to 7 days, it still takes your body sometimes several weeks to months in order to really get the full benefits of that microneedling treatment. So your body may be producing new collagen for a period of several weeks to months. And so even if you don't see amazing results 3 weeks after your treatment, it might be significantly better 6 to 10 weeks after your treatment. Because of this, we know that it's important to wait an appropriate amount of time between your microneedling treatments. What I advise most of my patients to do is to wait at least 4 weeks between those treatments. We usually have a good idea how many treatments somebody will need, but we want them to start generating that collagen before we re-injure the skin. And I think, in my opinion, is that 4 weeks is the minimum amount of time that you should wait. But if you wanted to wait 6 or 10 weeks, you could, and you wouldn't be losing any of that benefit. And again, one of the most common questions that I get online, not necessarily in the clinic, is, can I do home dermarolling, and how does that compare to microneedling? Dermarolling is very popular, and there's a lot of devices out there. Sometimes it is called microneedling, but usually this is going to be on a roller, and it's going to be a wheel that has lots of little needles coming out of it. Almost looks like a spike wheel. And these needles are usually much smaller than the typical microneedling treatments that you would get in the office, and it's designed to be rolled on the face or over the hair if you're trying to use it to promote hair growth. And I'm not completely opposed to home microneedling or home dermarolling. I think there could be a role for it, but there's a few important things that you need to know if you're going to be using it. I've actually done a whole video on this topic, and I'm going to put the card for that up here so you can watch the whole video if you want. But some of the essential things to know if you're going to be home dermarolling are to make sure you're purchasing a reputable device, a reputable company making that, so that you're getting really good quality products that aren't going to be giving you allergic reactions due to cheap metals. You should always sterilize the tool before and after use. So you need to treat it with alcohol. And although I say sterilize, you're not truly sterilizing it. You're just essentially cleaning it, because if you're not putting it through an autoclave, it's not going to be sterilized. You also should generally select a device where the needles don't go longer than 0.25 millimeters. You don't want anything that goes deeper. I don't believe that home dermarolling treatments should be drawing blood. I think that increases your risk significantly. If you want to incorporate a home dermarolling practice, you need to be committed to purchase a new device frequently or to replace the head of that device. You shouldn't be taking the cheap way out on this. If you can't afford to replace the roller frequently so that your needles are always sharp, you shouldn't be doing home dermarolling. And lastly, do not do home dermarolling if you have any compromise in your skin barrier. So if you're dealing with active acne, active eczema, or, heaven forbid, any cold sores, I do not recommend doing any dermarolling because you could spread an infection around on the tool, especially with a cold sore, that herpes virus. You could carry that all over the face, and it could be catastrophic and create lifelong scarring. So in short, yes, dermarolling can be done safely at home, but there's some rules that you should follow. It's not going to deliver the same type of results as microneedling in the office, but it can be something you could do between your treatments as long as you're doing it safe. I have a favorite home dermarolling device. It's called Beauty Magnet, and I'll leave the link for that down in the video description. That wraps it up for microneedling. We're going to move on to the questions that came in about retinol. Retinol is one of my favorite skincare ingredients to use, and I use it most every night to help fight the signs of aging like fine lines, wrinkles, and pigmentation. Everybody wants to know, when can I start a retinol, or at what age can I start a retinol? Well, we prescribe retinoid medications to our patients who are battling acne, even at sometimes as early as 9 to 11 years old, if they're developing acne at those ages. And so it's not uncommon for teenagers to use this at some point for their care of acne. And so for that reason, it is safe to start almost at any time. But if you're really using it just to fight the signs of aging, You probably don't need to start that in your teens, but you could start that in your mid to late 20s. Always be wearing sunscreen though, because retinol can increase your sun sensitivity, and you're not going to need as much retinol later in life if you're wearing sunscreen earlier in life. Another question is, I want to start retinol, but I'm afraid of the purge. Any tips? There's a lot of people online that fear what they call the purge when it comes to starting a retinol. And this is the idea that retinol is supposed to make you really irritated, dry, scaly, flaky, or even to have a really big explosion of acne. And this really isn't the case. Usually when I see videos that are talking about the purge, it's because they were using too much retinol or they started too quickly. So if you want to avoid those types of symptoms that people commonly call the purge, you should pick a retinol that's not too strong. It's totally okay to use an over-the-counter retinol instead of a prescription if you're just fighting the signs of aging. Just like the best sunscreen is the one you like to use, the best retinol is the one that you like to use and that you can tolerate using more frequently. I'd rather have somebody use a less potent retinol that they can use 4, 5, 6 nights a week than somebody who tries to pick too strong of one and they can only use it once a week. One of the best tips to avoid irritation from a retinol is don't start every day when you're just beginning with your retinol. It's totally fine to start every 3rd day where you put the retinol on and take 2 days off. And then you'll move up to every 2 days, and then eventually you might be able to move up to every night. I also recommend only applying your retinol to dry skin. When you apply retinol to damp skin, it's much more likely to cause irritation. Once you've applied that retinol, it's okay to add a moisturizer afterwards. And that can be a nice moisturizing cream or lotion, or you could even do hyaluronic acid and then a moisturizer. But I do advise moisturizing the skin after applying a retinol, especially if you're just getting started. If you're interested in finding a good retinol, I've got several recommendations down in the video description. And lastly, to wrap up this AMA, we're going to be talking about sunscreen. It's the beginning of summer, so this is a great time starting your sunscreen into your routine and making sure that you use it every day. Even if you're not planning to be out for extended periods of time, I like to tell my patients, dermatologists want you to wear sunscreen just like dentists want you to floss your teeth. Every day, rain or shine, no matter the conditions, just get in the habit of doing it. One person asked for some sunscreen do's and don'ts. So let me give you just a couple of tips of things you should do and things you shouldn't do. Things you should do. Pick a sunscreen that is SPF 30 or higher. I often will use a 45 or 50 sunscreen, and make sure that you reapply every 2 hours when you're going to be out. Now for me, honestly, I put it on in the morning before I go to work, and then I'm not reapplying in the middle of the day because I'm inside a building and I do have some on. But I do tend to reapply before I start my drive home. However, if I'm going to be out on a Saturday doing work in the yard, I'm going to reapply much more frequently under those conditions. A sunscreen don't is don't pick a sunscreen with a low SPF thinking, I'm going to get a little sun protection and get a little bit of color, because any color is indicative of UV damage and DNA mutations that could increase your risk of skin cancer. I've also seen a trend of some people on social media who use sunscreen to contour their face. So they want to get a variation in the tan lines on their face, and this is stupid to me, where they'll put a higher SPF on over their cheeks and a lower one over their cheekbones so that they get a little more color up on their cheekbones and a little less color, and almost get like a sun-induced contour look that they would try to achieve with makeup. And this is just causing sun damage on the skin and increasing the risk of skin cancer in a very sensitive area like the face. The next question I thought was really good is, what time of day should I stop applying sunscreen? So I'm going to take this question as if you're just going to be outside, at a family reunion or at the beach or something like that, where you're going to be out most of the day. I also think that this could be applicable if you're starting that drive home from work, like I do. I'll be leaving work at maybe 5 or 6 o'clock, and I put on sunscreen then, but I usually don't reapply even if I'm going to be out for a little bit longer. It's something where as that sun, gets to 8 o'clock, even in the summertime, it's very low in the sky, and the intensity of UV rays are just not that significant. You could still get a burn under those conditions, but I do have some sunscreen on, even if it's starting to fade at that time. And I'm also just talking about real-world use. Even though I'm a dermatologist, I've still had sunburns as a kid and even as a dermatologist or a dermatology resident, still live in the real world, still have human habits and make mistakes. So that's kind of my behavior, is that I'll put it on a drive home, or I'll put it on after dinner if I've been outside most of the day. But I'm probably not doing another application at like 8 o'clock, even if the sun's still going to be up for another 90 minutes. That's just my personal preference and my habits. Maybe there's a time where you should be reapplying it if you're out on an equatorial vacation, but this is the real world, and that's my habits. This question comes up frequently: is there a benefit to using an SPF higher than 50? Dermatologists always recommend using an SPF 30 or greater. That's going to block about 94% of the sun's UV rays. And then if you get up to a SPF of 50, you're getting like 97% of the rays blocked. So it's only a 3% increase. But if you look at how many more UV rays you're getting, you're going from 94 to 97%. So you're leaving 6% open at the SPF 30 and 3% open at the SPF 50. So you're actually getting 50% fewer UV rays hitting the skin if you go up to a little bit higher SPF level like SPF 50. Now when you go up to a 70, again, you're maybe cutting that in half again, but you're still going from like 97 to 98, 98.5%. So I do think there is the law of diminishing returns here. You're going to be spending more for that SPF 100 sunscreen, and it's probably not going to do a whole lot more for you than an SPF 70, for example. But here's where it can make a difference is, again, this is the real world. When sunscreens are tested and given their validation by third-party testers and submitted to the FDA, they're tested at a concentration of 1 gram per centimeter squared. So they take the sunscreen, they put it on somebody's arm at that concentration of 1 gram of sunscreen in a centimeter square, and they rub that in right in that area, then they expose it to light to see if it burns. That's a lot of sunscreen actually, and most of us are not putting on that much. Remember that if you're applying sunscreen for your face and neck, you probably should be using about 3 finger lengths of sunscreen. So apply your sunscreen to 3 fingers, and that's going to be generally enough to cover your full face and neck, and it's quite a lot of sunscreen. If you're in a bathing suit and you're going to be outside at the beach, you need about 1 ounce or about a shot glass full in order to cover the whole body. The reality is that most of us just take a little bit in our hands, rub it on our face, get our ears, the neck, maybe a little bit on our arms, all from that one application, and it's just not enough. So if you're applying an SPF 30 in that fashion, you might only be getting an SPF 10 to 15 out of it because you didn't apply enough. So the contrast to that is, what if you're applying an SPF 70 like a normal person? You might then be getting an SPF 30 out of it. So I do think that there's benefit to going higher, but you do probably get pretty big diminishing returns after about SPF 70. And the last question is, hasn't sunscreen been shown to cause skin cancer? And the answer to this is simply no. There's no currently available human data that shows that the ingredients in sunscreen are causing skin cancer. A lot of people like to point to the fact that skin cancer rates have been steadily rising, as well as the rates of sunscreen use have been steadily rising. But what we know is that sunscreen does definitively decrease the risk of developing skin cancer. That's been shown by many good Australian studies where the risks of skin cancer are very high. So they did a national interventional study there. We also know that people are living longer than they ever have before, and skin cancer is generally a disease of the elderly. And so most of the elderly that are getting skin cancer now, and we're seeing those exponentially higher rates, were those that were growing up before they were in the habit of wearing sunscreen. So it really is not accurate to say that sunscreen is causing it. Just because you see a correlation doesn't mean that there's a causation. If we saw that sunscreen was causing skin cancer, we would see that dermatologists have the highest rates of skin cancer in the country because we're the biggest advocates for sunscreen use, and we simply don't see that. Some people may point to the fact that a couple of years ago, benzene was found as a contaminant in some sunscreens. And many dermatologists, including myself, were the first ones to jump up and to share this information on social media because there was a large recall from a number of brands. Because benzene has no benefit in a sunscreen. It shouldn't have been there. It was something that was used probably in developing the formula as a reagent, but then it should have been extracted, and it wasn't completely extracted. So the levels of benzene were actually still very low, but benzene should not have been in those formulas. And high amounts of benzene can definitely cause cancer internally, but hasn't really been associated with skin cancer. It appears that all of those companies that made those recalls have corrected the formulas and made sure that benzene is no longer in those sunscreens as a contaminant. But remember that there's a lot of other things that could give you exposure to benzene, and if you're just sitting around a campfire in the summertime, you're probably inhaling more benzene than you would ever get from using sunscreen all summer long. So to reiterate that, sunscreen has been shown definitively to reduce your risk of sun damage and skin cancer over the course of your lifetime, and I highly recommend wearing it. If the data changes and we do start to see evidence, I'll be one of the first to get out there and share that information and say, stop using this sunscreen. But we have to go by the data that we have now, and that is that sunscreen is safe and effective in preventing sunburn and skin cancer. That wraps up the questions that came in this time. Make sure that you pay attention to the Instagram stories and the posts on this page so that you can keep up to date with the times that I'm going to be soliciting more questions. If you have particular topics that you want me to address in the future, go ahead and leave them as a comment on this video, and I'll make note of that to include in future videos as well. I want to thank you guys for watching and supporting the channel. Remember that if you like any of the products that we talk about and you purchase them through the links in the video description, it does help to support the channel. I hope everybody has a great summer and that nobody watching this video ends up getting a sunburn. I'll see you guys on the next video.